Hey guys, Arthritis Warriors, this is Dr. Joe Flordelis, and right now I want to share with you that I am an Iron Man fan. If you are a fan of Iron Man, shout out to you too. But today I'm going to discuss about the top exercises that our friend Josh mentioned to us that is really good for your knee osteoarthritis. So the first exercise that Josh showed us is actually this. You get a pillow, and it could be any pillow from your house. What we are going to do is simply get a pillow, put it in between your legs, and you are going to squeeze. So we're gonna do this exercise, just squeezing this pillow. You note outwards and then hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You rest for about 5 seconds, and then repeat it for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, rest again. And again, this is a simple exercise that you can do. It actually activates the muscles in the inside part of your thigh. So the muscles here in your thigh, you're going to exercise that. The next top tip that Josh showed to us was an exercise just marching in place. So if you're on a wheelchair or if you're sitting down, it's okay. What you want is to activate the hip flexors here. So these are exercises that you can do by yourself at home, marching in place, and you can do this for 5-10 minutes if that makes you feel better. What you really want when doing these warm-up exercises is to get the blood flowing into the joint, into the muscles. A warmer body creates less chances of injury, and that way you can do a lot of other things as well. The next exercise that I'm going to share with you is something similar. You're still going to just sit in place, but this time you are simply going to do a little bit of kicking. So let's do this. We're going to kick. This is an exercise Josh showed us. Kick to the right, kick to the left, and you can do 10 to 20 reps before you rest. Of course, it will always be up to you. Personally, I'd like to do about 10 to 20 reps. And when you're doing these exercises for about 10 times, 20 times, you want to make sure you are stable in a very stable chair. You don't want to fall or injure yourself when doing these exercises. It's really best if you have your own physical therapist, PT, someone who can guide you, or you could do these exercises in addition to the other exercises given by your physiotherapist or physiatrist, your rehab doctor po. Now, a lot of the other patients in my clinic, they have a problem with balance. So when they are walking po, paika-ika parang ganon, no? So parang matutumba. And I've mentioned in my previous post, there's always a risk of patients with knee arthritis falling down, tapos po, mababali yung buto. They will have hip fractures, and you don't want to have a hip fracture. So the first thing that we want to address is if you know someone na paika-ika maglalakad po, you want to improve their balance. And how do we do this? Through some of these exercises that we are teaching you right now. The next few exercises, you're going to be standing up, and if wala na pong balance masyado yung pasyente, you might want to have someone assist them, with a belt around their chest para po hindi sila mahuhulog. So, pag wala pong balance, there are people who actually put a belt tapos hahawakan nila po yung pasyente. That way, they don't get to fall. But again, if you do this, I'm assuming na wala po kayong access, nasa probinsya po kayo, walang physical therapist na nakakatulong sa inyo, walang rehab doctor. So these are things that you can do. And again, pag may walker po yung pasyente, you wanna have them use the walker when doing these exercises kasi simple lang po yung exercises natin. So we're gonna do the first exercise. Hold on to your walker, tapos we're just going to go forward, tapos backward po. It may seem very simple po, but again, patients without balance, without muscle, they can find this activity very stressful or even very hard. So for the first few times, you don't need to do a lot of reps. About 3 to 5 is okay, but later you want to gradually be able to walk kasi. And if you don't have the balance, you don't have the strength, you're going to have to develop the muscle to do these exercises. The next exercise that I'm going to show you is very similar. Kung kanina, forward one step, tapos backward one step, we're going to do something similar, but it's actually a side-to-side motion po. So we're going to just make sure everything is clear, no? Walang matutumba. If the patient has a walker, hold the walker po, tapos exercise to the side, to the left, then to the right. Just small steps, paulit-ulit. If you're able to do these exercises, then very good. These are, again, very good exercises for balance po. Ang goal po natin dito is hopefully able to stand on one leg at makakabalance ng matagal yung pasyente. But again, make sure that if the patient has a difficulty with the balance, may malakas na tao, may belt po, or even if you have a licensed PT or access to a rehab center, much better po para maalagaan yung pasyente to avoid falls. Now, going on to the next exercise po that we're gonna do, we're actually going to do ito po yung hamstring curl. So again, hamstring curls, I'm going to show you. Hahawakan niyo po yung walker. Tapos, what you want to do is just ask the patient to curl up 1. Tapos, kabila na naman. With your left, curl up 2. Tapos, curl up 3. To the other side, 4. And 5. So, do these exercises until failure po or pag napagod na po yung patient. We really want to activate these muscles so that the patient becomes stronger, and you're not going to become strong if you just do what is easy. Kailangan talaga mapagod konti yung pasyente. And I don't need you to do these exercises every day. You can always have a rest day for your patients. I hope this was helpful. I will see you in the future.